there was a systematic review and meta-analysis looking at mental health, specifically around pediatrics. Basic summary, we know that mental health is a huge component for concussion and concussion recovery. And obviously, this article kind of kept in line with that. So they had 40 articles that were kind of included here. And the conclusion was that mental health is central to concussion recovery. Assessment, prevention, and intervention of mental health should be integrated into standard follow-up procedures. And we have some of the kind of review of, the findings here. What is known already? Well, it's a common injury, and some studies, it's kind of a mixed bag, specifically with mental health towards children and adolescents. And the symptoms of concussion obviously overlap with mental health conditions as well. So some of the new findings that come out of this review, highly relevant to concussion recovery, although the ways children respond to concussion are diverse. Minority of children experience clinically significant mental health symptoms that warrant clinical attention, particularly the presence of post-traumatic stress. And I actually have an article, another study at the end of this presentation that talks about post-traumatic stress in children that were hospitalized with MSK injuries and what they call extracranial injuries versus concussion. And you actually see that, there's a lot of overlap even there. So PTSD may be an underlying factor here. Current evidence established pre-injury mental health difficulties is the strongest and most consistent predictor of pediatric post-concussion mental health outcomes. But novel diagnoses occur in approximately 1/3 of young people after concussion. So the concussion may be the inciting event to bring on or at least expose mental health. Psychological resilience and family characteristics are promising, largely unexplored. In contrast to recovery from post-concussion symptoms, more generally, mental health symptoms may take longer to resolve, right? And so this is why a lot of our patients that we are considering to just be PCS may actually be suffering more from the mental health side of things, which is why we include it pretty heavily in our management practices. Current evidence supports the use of the biopsychosocial model for understanding the factors contributing to the development and maintenance of mental health difficulties. So clinical practice, really the big takeaways here are it should be evaluated as part of standard concussion assessment, or at least have it in the back of your mind. I mean, oftentimes education can just go a long way, but it's something that we should have in mind, particularly considering things like anxiety and depression, if further management needs to be considered.